Hey guys, welcome to my new podcast series, Your Health You Care. Hello everyone, welcome to my YouTube podcast series, Your Health You Care. Today I'm going to talk about the human metapneumovirus scare, the HMPV that you might be noticing in the news channels making headlines. Essentially, the outbreak happened in China. There were multiple cases, and it was considered as an epidemic in China a few weeks ago. Today, when I was looking at the news, there were 3 cases already registered in India, in the Karnataka, Bangalore. They were found in um, 3 months old and 8-month old child. Well, so before bringing everybody into panic, let's talk about it. What is this virus? Is it as bad as the COVID-19? Well, to answer that question, this is not, so far, this is not as bad as the COVID-19 virus. But the patients who were diagnosed with this condition, they definitely had severe respiratory tract and pneumonia-like symptoms and influenza-like complaints, and they were diagnosed and they were kept in the ICU, and a lot of morbidity and mortality happening in terms of China. So in India, even if you have a history of traveling, or if you have been exposed with Chinese population, you should not be worrying as of now. However, a lot of precautions need be taken. Precautions including, just like COVID-19, number one is to maintain the social distance and wearing the face mask as sophisticated ones as you can find. N95, not as of now, but at least the face mask to cover your face. All right. So, what are the complaints that one might be presented with if you have the HMPV infection? Just like flu-like symptoms, fever, nasal congestions, blockages, breathing difficulty, and respiratory distress. You might be putting more efforts while breathing. You might be looking for air and looking for an area where you can breathe properly. And fever can make it worse. And if you are immune compromised, if you have diabetes, and if you have HIV or other immune related or is post operated, then you might need to take extra care. In terms of medications, so far it is just the symptomatic and management that one can do. There isn't particular vaccine or there isn't particular treatment regime that one can follow. ICU admissions are recommended with respiratory distress anyways. And if you are a patient of COPD, seasonal asthma, and if you already if you are being treated for these conditions, your doctors need to pay more attention. Your doctors need to take more care of you and make sure the ventilations are available in the premises you are admitted in. And if you have family and friends diagnosed with some kind of respiratory infections, you should also maintain distance. And isolation is recommended for a diagnosed case. During the COVID, uh, majority of the systems and doctors and institutions and the families and population had no clue what to do about it. But after COVID, I believe everybody is well prepared for this kind of pandemic and outbreaks. Like I said, if you're elderly and immune compromised, make sure you're looking for oxygen concentrator. At least have the oxygen concentrator handy for you. In if needed, they should be available for you right now. And make sure you are following up with your doctor. And if you haven't taken any flu shot in the 2024, you still have a chance to get your flu shots. They are the common flu shots that you take for common viral infections. But if you haven't taken, then go for it. There is no particular recommendation of self-medication, like during the COVID you had paracetamol, dolo, and steroid and multivitamins, vitamin C, and there were other symptomatic treatments which you could take over the counter or self-medicate yourself. At this situation, I do not recommend that you well in advance have them. If you have a chance, if you can go see a doctor, go see a doctor first, and then consider the self treatment for the HMPV. HMPV is it's the full form is metapneumovirus. So metapneumovirus is a species of virus just like COVID-19 or any other coronavirus or any viral infection. And this was, as per the history, this was found earlier also, long ago, and this is not the first occurrence. However, this kind of outbreak is first, and if it is happening in China, it can happen anywhere. Now we are living in the one world, so people are traveling across, and you never know what happens tomorrow. So don't take it for granted, but do not panic about it. At the same time, any kind of respiratory complaints, you should go consult a doctor before you want to treat yourself. So far, this is what I want to share with you. And if it becomes worse, or if it becomes more relevant in our society, then I'll come up again with another video. Till then, take care and go get some fresh air.